Hi there, my name is Cosette Faivre. I'm a veterinarian over at the Hagyard Equine Medical Institute, and I'm here to talk to you guys today about endocrine diseases in older horses. These can significantly affect their quality of life and their longevity, so it's really important that we are diagnosing and treating these diseases as early and as effectively as possible. The first one I'm going to talk to you guys about today is pituitary pars intermedia dysfunction, or PPID for short, which is commonly called equine Cushing's disease. This is a degenerative disease of the brain, which ultimately results in an increased production of corticosteroids or stress hormones. These horses are oftentimes our senior horses, so the typical age we diagnose this is around 14 years old, but we can see up to 20% of horses at 15 years old that have evidence of this disease, and the incidence does increase as animals age, as the population ages. Typical clinical signs associated with this are going to be things like a long hair coat and loss of muscle mass, so loss of top line, loss of their abdominal musculature. We can also see things like patchy fat deposits, abnormal sweating, increased urination and drinking, and dull mentation, and an increased history or frequency of laminitis. So we can see many different changes with these horses. The other thing that we can see is an increased predisposition to infections. So sinus infections, tooth root abscesses, and hoof abscesses and ocular ulcers are some of the ones that we think about more commonly. We do diagnose PPID with a test called an ACTH, or an adrenocorticotropin hormone test. So there's a couple different tests for ACTH that we can do. So it's important to touch base with your vet about what the best test for your horse is. Some of these tests do require a brief fast beforehand or a partial fast. So just make sure you're touching base within 24 hours of testing to ensure that you're following the correct pre-test protocol. And then once we test, treatment for PPID, if the horse is positive, is with a drug called Pergolide, which is currently, I believe, marketed as Presend. And so this drug basically helps reverse some of those changes or stabilizes some of those changes in the brain that can cause the clinical effects of PPID. Usually we're going to see improvements starting as early as a month, but for things like the hypertrichosis, the long hair coat, that can take up to several months to a year to fully resolve. Ultimately, horses do significantly improve their quality of life and their longevity of life, usually when they're on treatment for this disease. So it is something I definitely recommend treating senior horses for and evaluating them. Even if they're negative 1 year, they may be positive the next year. So repeat evaluation is very important. And we can, again, significantly improve their welfare by treating and addressing this disease in them. So PPID is actually a disease of two different sections of the brain. The first is the hypothalamus, and that's actually the section that is primarily diseased, that is dysfunctional in PPID. But that hypothalamus affects the pituitary gland sort of downstream, and that pituitary gland is what's responsible for secreting the precursors to our stress hormones. And so that's where the PPID, pituitary pars intermedia dysfunction, that's where that name comes from, is that abnormal function of the pituitary.